management of the Ghana Police Service Hospital has expressed concern over the increasing number of patients whose identities remain unknown upon arrival at the facility. According to the hospital authorities, many of these unidentified persons are victims of road accidents or incidents involving police patrol operations, were brought in unconscious or without identification. There's more in the following report.
The pathologist at the Ghana Police Hospital, ACP Dr. Osei Owusu Efriye, described the situation as worrying, noting that the growing number of unidentified patients is placing immense pressure on both the emergency unit and the hospital's mortuary. He explained that the hospital often has to rely on internally generated funds to cater for such patients, from providing medical treatment to preserving their bodies in the morgue should they unfortunately pass away.
We have faced a lot of logistical challenges with where to place these persons. We've had to use our internally generated funds, sometimes running into over 1 million cedis every year for the ones who are alive, and close to 500,000 cedis a year for the deceased persons. This morning serves encourages all of us who may have some resource to be able to help our underprivileged ones to also come in and help us. We do not know when you can come in as an unknown person. These persons sometimes are people who have traveled from other parts of the country and have come into the city and probably have been knocked down by a vehicle or have fallen sick.
The medical director of the facility, COP Dr. Samuel Otunyako, also highlighted that the surge in the number of unknown patients necessitated the construction of an additional ward to accommodate the growing patient load. The new ward, he said, was built through the support of businessman and philanthropist Alhaji Seidu Agongo. Dr. Otunyako further appealed for more assistance to help complete an administrative block for the police mortuary, which he said would improve service delivery and record management.
We have several challenges, but the one that was acute was where to place people who are found wandering in town, ill, people who are injured, maybe beaten and left somewhere. You know, our policemen go on patrols and they are brought here. And when they come as police officers, we cannot send them anywhere. We cannot refer them on to another facility. We have to accept them. And we had about 11 beds in the emergency department. And there were times that these 11 beds were occupied by such people. So what happens when other people have emergencies? They come and we have to quickly refer them, not because we are unable to handle them, but because the space simply wasn't there. So that was the main challenge that we had. And luckily, Alhaji Agongo and his people have come to construct this structure for us, which we'll use for such people. When you look at our morgue, it's an old morgue. We've tried to restructure it and make it better, but we needed a separate space for administrative purposes.
For his part, Alhaji Seidu Agongo stated that his decision to support the hospital was aimed at improving healthcare delivery and contributing to the welfare of both officers and the general public who rely on the facility. He urged other benevolent individuals, corporate bodies, and organizations to also support efforts to strengthen healthcare infrastructure across the country, especially at public hospitals.
And word to other businessmen and the young guys is that let's always look at long-term progress. Let's not look at short-term. Somebody will say, oh, the salary is not enough. Oh, it's not salary. Look at the police people. Look at the way they work. Go and check how much they are paid. But, you know, when it comes to success, success goes beyond you to your kids, to your family. And you have no control over that. It's only when you willingly, openly do things for people without demanding anything that grace will fall on you.
Meanwhile, ACP Dr. Osei Owusu Efriye reiterated his call to the general public to visit the Ghana Police Hospital to check and identify any relatives or friends who might be among the unidentified patients currently receiving treatment.
Again, to all of us, if you have a relative who's been missing for a while and you are not sure where the person is, the person may have been knocked down by a vehicle, the person may have gotten sick, you know, having come into Accra, come around speak to administration, see if you can identify your relative, and that will also be very helpful to us.